Okay, this is the final part of exercise physiology. We'll be looking at homeostasis and then two new systems as well, the endocrine system and the nervous system. Now, this is quite a long unit, so to make it a little bit more manageable, I've broken it down into 7 different sections. So we'll start off looking at homeostasis, then go into the nervous system and endocrine system, and then we'll look at some specific examples of how those systems work and different environments, for example, like exercise in the heat, exercise in the cold, altitude, etc. So to begin with, we're going to look at homeostasis. Homeostasis is simply defined as the process of maintaining a stable internal environment, and without this, we would not be alive. So our body always tries to regulate our internal environment, whether that's our internal temperature, whether it's the amount of oxygen that's being delivered around our body. Our body will attempt to keep everything within very, very close parameters and keep everything normal. That's basically what homeostasis is. A few key examples that we'll talk about in further detail today are temperature regulation, so how we maintain a core body temperature of 37 degrees. That can fluctuate a little bit, but it's a pretty tight limit of our core body temperature. So depending on the environment outside, how do we maintain that same core body temperature? If we're in a freezing environment or a super hot environment, what will our body do to maintain that? Blood glucose regulation, so how much sugar is going through our bloodstream and how our body will control that. We've spoken a little bit about insulin before, so this shouldn't be a completely new topic, but how our body manages and balances insulin and glucagon to control the sugar or glucose in our blood. And we'll also talk about blood pH regulation, and this refers back to when we looked at the respiratory system, because keeping our blood pH between 7.35 and 7.45 is primarily done through the respiratory system, through breathing and also through the kidneys. So in terms of maintaining homeostasis in the body, the primary way that we do that is through something called a negative feedback loop. So it works by detecting deviations from a set point. So say my set point body temperature is 37 degrees Celsius. If that temperature goes up or goes down, that's going to send a message back to my brain and tell me something's wrong and trigger the mechanisms to reverse that change. So there'll be a stimulus, a sensor or a receptor that will identify that change. That will go to a control center, and then there will be some sort of effector. So it's a very complex way of putting it, but it's really quite simple. So if we think about body temperature, say my body temperature is getting too high, the nerve cells in my skin and in my brain will detect that the body temperature is too high. That message will get sent to the regulatory center in the brain that looks after my temperature, and that will produce some sort of response. And in terms of body temperature, if we're too hot, we start sweating. We also have some vasodilation as well, which is where our blood vessels become wider, especially towards our extremities, so that more blood gets towards our extremities, towards our skin, so it can cool down from the outside air. So this is a negative feedback loop. Again, body temperature here, I'm going to the right, so if the body temperature is too high, that's going to trigger vasodilation, that dilation of the blood vessels near my skin, and sweating, and therefore heat will be lost. If my body temperature is too low, that will trigger vasoconstriction, so my blood vessels would become more narrow to keep heat in, and shivering as well, because with muscle contraction that occurs when we shiver, so shivering is just like mini involuntary muscle contractions, that produces heat. So heat will be retained and the body temperature will remain within its normal limits. We can also see examples with blood glucose levels. So if our blood glucose levels are too high, let's say we've eaten a really high carbohydrate, high sugar meal, in response to that, the pancreas will release insulin, and then the liver will remove that excess glucose from the blood and store it as glycogen, or store it as fat as well if we've got excess glucose, and that's glycogenesis. If the blood glucose level is too low, so say I've been fasting for a while, I haven't eaten anything in quite a few hours, and my blood glucose levels begin to drop, the pancreas will release glucagon, and glucagon will trigger the liver to break down that stored glycogen and release it as glucose into the blood, and that process is called glycogenolysis. And then finally, blood pH. So if our blood pH is too high, that means it's alkaline, we decrease our breathing rate and the carbon dioxide level increases. So blood pH is very much related to carbon dioxide. For example, when we're exercising, we have higher levels of carbon dioxide in the blood, which makes our blood too acidic, so the pH drops too low. Therefore, we increase our breathing rate to get that carbon dioxide out of the system and keep that blood pH back within its regular range. So these are examples of these negative feedback loops, but we also need to have a look at something called a positive feedback loop. Now, there's only one example of a positive feedback loop that you'll need to know about. The rest are super complex. For most things in the body, almost everything you could think of, it's a negative feedback loop that controls it, but you need to know an example of a positive feedback loop. The key difference is that a negative feedback loop is stabilizing a process, so always trying to keep something within a stable range. However, a positive feedback loop amplifies a process, it exaggerates it. And the only example I want you to know about is during pregnancy, when a woman is in labor, oxytocin is released with muscle contraction, and that oxytocin triggers more and more and more and more contractions and amplifies that labor process until the baby is born. Now let's have a look at exercise in the heat, a little bit of a case study here. So we've learned a little bit about homeostasis, and we know a bit about exercise in the heat and what responses that causes. So when we are doing exercise in hot conditions, we have really big issues in regulating our core body temperature. So the response is that our core body temperature will rise, and that triggers sort of a competing challenge. So we want to maintain our blood flow to the muscle so that our muscle can receive the blood and the oxygen that's carried in the blood to create ATP, resynthesize ATP. So ideally, when we're exercising, we want to put all of our blood towards our exercising muscles so that they can get all the oxygen that they need to create energy. However, when our core temperature increases as well, we're going to vasodilate the blood vessels around our skin. So we want to send blood to the skin so that that blood can cool down, so that heat generated during the exercise can be lost to the environment. So these are the two issues. These are the two sort of thermoregulatory mechanisms. So the way that we control this is vasodilation, which is where the blood flow goes to the skin to cool down. That's why you get a red face when you exercise. And sweating as well. So sweating is the second thing that will happen when we're exercising, especially in the heat. And these both hinder our performance. They're both taking away the muscle, the blood that we need from the muscle to other areas. And let's have a look at how that actually occurs. So with vasodilation, we have skin blood flow increases. So the blood is going to the skin rather than to the muscles. So we've got less blood flow to the muscles and the heart, which means we're going to have a lower stroke volume because there's not as much blood returning to the heart. So the heart's got less blood to pump out with each beat. Therefore, the heart will increase its rate. So we'll have an increased heart rate, which will reduce our performance. Sweating works in a similar way. So when we sweat, we have a loss of fluids, we have dehydration, which is equivalent to lower blood volume. So when we sweat, some of that blood volume from our plasma is what's sweat out. So we're losing our blood volume, which means there's less blood for our heart to pump around, which means there's a lower stroke volume, an increased heart rate to compensate for that, and therefore reduced performance. So at the end, the vasodilation and the sweating mechanisms both result in the same decrease in performance, the same mechanism for the decrease in performance. It's just how the blood, how how the blood volume is decreased. So blood volume is decreased with vasodilation because the blood's going to the skin, and blood volume is decreased with sweating because it's being sweat out. Okay, we're going to have a look at the nervous system now. So let's get into it. We have got two separate parts of the nervous system. We have the central nervous system, which consists of the brain and the spinal cord. It's down the center. It's the big central structures, the brain and the spinal cord. We also have the peripheral nervous system, which is divided into the somatic and the autonomic categories. So the somatic nervous system, this one controls our voluntary movements. It transmits signals to our skeletal muscles. And the autonomic system is automatic. Think autonomic, automatic. It controls involuntary actions. And this one's divided again into sympathetic or parasympathetic. And I'll get into what those are in a moment. But let's first have a look at the central nervous system. So the central nervous system, the brain and the spinal cord, it processes the information that comes in from our senses and sends out instructions to effectors, either muscles or glands. Okay, so you guys need to know some of the different lobes of the brain and just a general overview of what each lobe does. So the frontal lobe, firstly, it's involved in motor control, so that's moving around, problem solving and speech. The parietal lobe in blue is involved in movement and body orientation. The occipital lobe is very much visual and sight. The temporal lobe is associated with hearing and language and memory. We have the cerebellum, which is involved in posture and balance and coordination. And then finally the brainstem, which is its purpose is mainly to control the respiratory and cardiovascular systems. So involuntary responses being breathing and the heart. Okay, the peripheral nervous system is what we'll look at next. So the peripheral nervous system connects the central nervous system to the rest of the body. So think about it as all of those nerves running through your body from your brainstem all the way down to your fingers and toes. Again, it's broken down into two parts. The somatic nervous system, which controls our voluntary movement. It very much just connects to our skeletal muscles and helps us to move. And then the autonomic nervous system, which controls involuntary actions. And this one's divided into the sympathetic nervous system. The sympathetic nervous system prepares the body for fight or flight. So it's very much involved in increasing the heart rate, dilating the pupils, having that flight or fight response. And then the parasympathetic nervous system promotes rest and digest. So it does the opposite. It reduces the heart rate. It stimulates digestion. It's like the chill one. Now, there's a few different receptors that we need to know as well. So how does our nervous system gather information and send that back to the brain for the brain to decide what to do and send out that effector information as well? So the receptors we've spoken a little bit about in the respiratory system, but we'll have a look at a few more here. The first one is proprioceptors. So these are located in our muscles and tendons, and they monitor our body position, and they're really important for sports, for athletic performance, for maintaining balance and coordination. And you guys probably have done some sort of proprioception training in your program as well, and you might be standing on a Bosu ball like this guy and catching something and trying to balance. This is all training your proprioception system. A few other receptors that we need to know about as well. Firstly is the baroreceptors. So these are found in our blood vessels and they regulate our blood pressure. They detect the changes in the stretch or the dilation of our blood vessels. And then the last one is our chemoreceptors, which we did speak about in the respiratory system, and they detect changes in carbon dioxide, oxygen, and the pH levels in the blood. And they primarily influence the respiratory rate in order to maintain stable numbers with carbon dioxide, oxygen, and the pH level of the blood. Now, the sympathetic nervous system, we said before, is our flight or fight system, and it prepares the body for stressful or high intensity situations. Its main job is to increase our heart rate, constricts or contracts our blood vessels, it dilates our airways and pupils, and prepares energy stores. So it prepares glycogen to be broken down into glucose for quick energy availability. Now, when we're exercising, this system increases oxygen delivery to the muscles and redirects blood flow from the digestive organs to the working tissues or the working muscles. So we want this system to be working somewhat when we're exercising, because we don't want to be, especially if we're doing high intensity exercise, we don't want to have to use valuable oxygen and blood on digesting what we've just eaten for lunch. We want that blood and that oxygen to go to the muscles that we need to work. Then we have the parasympathetic nervous system. This is our rest and digest system. It helps to conserve energy. So it does the opposite. It lowers our resting heart rate, it enhances digestion, it constricts our pupils, and stimulates recovery post-exercise. And we're going to have a look now at what these two systems do in terms of influencing the heart during exercise. So we know that there are intrinsic mechanisms of the heart which help to set the pace and set the rhythm of the heartbeat. So we've got the sinoatrial node, and if you remember, the atrioventricular node as well, which send those conductions through the heart to get the heart to beat. But the autonomic nervous system, so remember the autonomic nervous system, also adjusts the heart rate based on the physiological demand. Are we exercising? Are we resting? What's our body doing? And that autonomic nervous system will help to adjust the heart rate based on exactly what we're doing. So during exercise, the sympathetic nervous system will increase our heart rate and stroke volume. So in order to increase the stroke volume, it's going to increase the force of contraction of the heart. So the heart not only beats faster, but it beats more forcefully to pump out more blood, to deliver more oxygen to muscles. Whereas the parasympathetic nervous system will reduce heart rate during recovery. Now, this isn't always the case. And we can see here, if we compare two different sports, a marathon runner versus a sprinter, that actually the marathon runner has the parasympathetic system play a really big role. It helps to maintain endurance and efficient energy use. And it then, of course, becomes, the 100% dominant system for the recovery and replenishing energy stores and repairing tissues after exercise. But during really long events or long exercise events, the parasympathetic system will play a larger role in order to maintain endurance and energy, versus something like sprinting, where it's very short, very fast, very reactive. This is going to rely heavily on that sympathetic system. So there's short bursts of maximal effort. We need quick access to energy and quick oxygen delivery to the muscles, which our sympathetic system will help us with. Okay, we're on to our third part within this unit. We'll be looking now at the endocrine system. So when we're thinking about the endocrine system, we're thinking really about two main things. We're thinking about hormones and we're thinking about glands. Now, what's the difference between hormones and glands? So hormones control and regulate all sorts of body processes. They control reproduction, metabolism, energy balance, our sleep, our growth, our development, our body defenses, how much water we carry, our electrolyte balance, etc. And our glands are the structure that make and secrete these hormones. So what we're going to look at now is a whole heap of different endocrine glands and the hormones that they produce and their function. Now, you can see in this picture, there's quite a few labeled glands here. Some of these labeled structures here aren't actually glands, but I'm going to go through the important ones with you now. So the first one The main important one is the hypothalamus. It's in the brain and it produces hormones that control the release of hormones from the pituitary gland. So this is kind of like the master gland, but it also helps to regulate our thirst, our hunger, our body temperature, and our sleep cycle. Basically, the hypothalamus controls the pituitary gland. The pituitary gland is also in the brain, right next to the hypothalamus. And this one regulates all the other endocrine glands, but it also does regulate growth, metabolism, and reproduction itself as well. All right, last one in the brain that we need to know is the pineal gland. This one produces melatonin, and you might be familiar with that. Melatonin is very important for our sleep-wake cycle, our sleep patterns. If you heard the term circadian rhythm before, that's basically our sleep-wake cycle, and it's very much controlled by this melatonin that's produced by the pineal gland in our brain. Okay, moving down, we've got the thyroid gland. This is in the front of the neck. It produces thyroid hormone and it regulates metabolism and energy levels. So it's quite common people have hyperthyroidism, which is where you're producing too many of these thyroid hormones. Also is quite common hypothyroidism, which is where you're not producing enough of these thyroid hormones. People with hypothyroidism often find it difficult to maintain a normal weight. Often they find it very easy to gain weight because their metabolism is slow. They have very low energy levels. So the thyroid is very important for metabolism and energy. Now, on the back of the thyroid gland, we have some little glands called the parathyroids. Now, these produce parathyroid hormone. It's very much important for regulating the calcium levels within our blood. We have the adrenal glands, which are down in the stomach. They're on top of each kidney. You can see those little yellow blobs on the tops of the kidneys. And these ones produce cortisol, adrenaline, and noradrenaline. And they're very important for regulating our stress response and our blood pressure. So adrenal glands are quite important glands, but also another super important one is the pancreas, which is located behind our stomach. It's the yellow corn-looking thing on this picture. It produces insulin and glucagon, which regulate our blood sugar levels, and we'll get into more detail with that soon. We also have ovaries in girls located within the pelvis, produce estrogen and progesterone and help to regulate our menstrual cycle and pregnancy. And then for the boys, we've got testes in the scrotum, produce testosterone, regulate sperm production, and we'll see soon the other functions of testosterone as well. Now, I want to go through some of the key hormones that we just mentioned. So we went through all the glands and briefly went over which hormones they produce. I want to take a closer look at some of those hormones now. So cortisol is a very well-known hormone. People call it the stress hormone. It's released by the adrenal glands, remember, on top of the kidneys. And this increases in response to stress and is there to help the body manage stress. So it's a very good hormone. It's got a bit of a bad connotation, but it also increases blood glucose levels, so it prepares that energy for the body to use, and it peaks early in the morning and declines throughout the day. So this is the normal sort of fluctuation of cortisol. Now, the problem with cortisol, where it gets its bad reputation from, is if you have chronic high cortisol. So if your cortisol is just high all the time, that can cause some negative symptoms. So headaches, cravings, excessive hair growth, bad sleep, weak bones, high blood pressure, and so on. But the main one is really weight gain, especially in the face and in the belly. So when we have chronically high cortisol, we've got a lot of glucose in the bloodstream, which is then going to be stored as fat. Okay, another two hormones I want to go over briefly as well are adrenaline and noradrenaline. You might also hear these as epinephrine and norepinephrine. So, for example, if you know someone who has an EpiPen, it's an epinephrine pen. These two are very, very similar, but they have just one key difference, but they're basically doing the same thing. Adrenaline increases the heart rate, it dilates the airways so that more oxygen can get into the lungs and through to the blood, and it increases the blood flow to the muscles. Noradrenaline increases blood pressure. So they're both very much involved in the sympathetic nervous system, that flight or fight response. And then finally, I want to talk briefly about insulin and glucagon. So these ones are both produced by the pancreas. So insulin is released when our blood glucose levels are high. We've eaten a high carbohydrate or high sugar meal. It helps the cells take the glucose from the blood and use that glucose to create energy, and therefore it decreases the glucose levels within our blood. Glucagon does the opposite. It's released when blood glucose levels are low, and it helps to break down that stored glycogen and release glucose back into the blood, and it increases blood glucose levels. So here's a quick little cheat sheet for you with all of the glands and a brief explanation of their hormones and their functions. If we look back at what we've learned now about the endocrine system and the nervous system, there's a couple of key differences. So the endocrine system releases hormones into the blood, whereas the nervous system sends messages as neurotransmitters via neurons. It's more of an electrical impulse. The endocrine system can affect any type of cell within the body, whereas the nervous system affects other neurons, muscles, and glands. The speed is the main thing I want you to remember, is that the endocrine system is slow working, but it lasts for a long time. The nervous system can send super quick messages, but those effects are normally short-lived. Okay, we're going to talk about performance-enhancing drugs now for a minute, because this has a very strong crossover with the endocrine system, because normally performance-enhancing drugs are hormones. So we're going to look at Lance Armstrong's first of all and see what he was caught taking. So Lance Armstrong, the ergogenic aids that he took. An ergogenic aid is just any substance that improves an athlete's performance. So he did erythropoietin. So we're going to talk about that in a moment. EPO for short. He did blood doping. We already know a bit about blood doping, where it's you take your blood out, you freeze it, and then you put it back in to boost up the blood volume you have and the red blood cells you have. He did testosterone, and he got caught for human growth hormone as well, HGH. Now we're going to talk about EPO, testosterone, and HGH. I'm not going to focus on blood doping today because we are talking about the endocrine system and hormones, so we're going to focus on the hormones. So EPO. EPO is produced by the kidneys. Now the kidneys aren't a typical gland, but they do produce some hormones, EPO being one of them. They stimulate the production of red blood cells. So when EPO is released into the system, it tells the body to increase its amount of red blood cells. Therefore, the blood is able to transport more oxygen to the cells and increases endurance performance. If we have more red blood cells, we have more hemoglobin that can carry oxygen. Therefore, we've got more oxygen circulating in our blood and more oxygen that can go to the working muscle and be used as energy. So when the oxygen levels are low, so say for you guys living in teen, there's not as much oxygen as there is when we're down at sea level. So when the oxygen levels are low, the kidneys increase their EPO production to stimulate more red blood cell production. So because there's a low amount of oxygen in the air, my body's going to compensate for that by creating more red blood cells to carry more oxygen. Therefore, I'm going to end up with very thick, dense blood that has a lot of cells in it. However, with only 2 to 3 weeks back at sea level, the red blood cell count can drop back to its normal levels. So it's not a lasting effect being at altitude. Okay, we're going to look at testosterone now. So why do athletes use testosterone? Few key reasons. Firstly, muscle growth. So testosterone promotes protein synthesis, which helps our muscles grow and repair. It increases our strength and power. It enhances our recovery, so it improves recovery times after intense training, allowing us to train harder and more frequently. And there's also some suggestion that it may improve endurance as well. In terms of the negatives, there's quite a few side effects of testosterone. So the first one is a hormonal imbalance. So when we have a lot of testosterone in the system, that can disrupt our normal hormone balance and lead to conditions like breast tissue development, acne, testes shrinking, and voice changes. It can lead to cardiovascular issues like an increased risk of heart disease and high blood pressure. It can cause psychological effects like mood swings, aggression, anxiety, can damage the liver, and can cause infertility as well. So quite a few bad side effects of testosterone. Okay, and finally, the last drug or hormone that Lance Armstrong was caught using was human growth hormone. This is a really interesting one. So human growth hormone is normally produced by the pituitary gland, and it stimulates growth, cell reproduction, and cell regeneration, and it's essential for normal physical growth in children and adolescents. So when we're going through our growth spurt in adolescence, this is determined by human growth hormone. So it is a normal hormone in the body. Now, why do athletes use human growth hormone? So there's several reasons why they might want to use HGH. First one is muscle growth. So it stimulates the production of lean muscle mass. It promotes the breakdown of fats, so fat loss. It can promote recovery, so it can, if we have an injury or something like that, human growth hormone will enhance the recovery process. It can also lead to increased energy levels and also anti-aging effects. So human growth hormone is a really interesting hormone. So even if you have, scars on your body, if you take human growth hormone, they're much more likely to go away. So it can affect a lot of things. It just basically promotes the body to keep growing and keep repairing, but there are some really nasty side effects. So acromegaly is an abnormal growth in the face, hands, and feet. You can see it in the picture here. Now, I'm not saying that he's done human growth hormone. Some people just get this disease naturally, but you can tell people who've taken human growth hormone because they have this really prominent jaw and forehead, and they can have really big hands and feet. They often also get some swelling and joint and muscle pain. They get fluid retention, insulin resistance, which can lead to diabetes, and as we know, and cardiovascular issues as well. But the main issue with HGH is that it makes things grow, right? So say you have a little tumor that might be a cancer when you get to 80 years old and you've never known, but you've got it right now. If you take human growth hormone, that will accelerate the process of that growing, and that might be something you have to deal with 1 year from now instead of 60 years from now. So some really important side effects to be aware of with all of those. Now, other ergogenic aids. So we've spoken about anabolic steroids, which is testosterone. It's also a hormone, and we've spoken about the other hormones as well, EPO and HGH. Are there any other ergogenic aids? So now I've gone through all of the ones that Lance Armstrong's done, but important to consider a few others in terms of sport. Firstly, diuretics, beta blockers, and stimulants. So let's look at diuretics first. Now, diuretics are basically like they're for rapid weight loss. They make you lose liquid. Athletes, especially in weight restricted sports like wrestling and boxing, might be attracted to using diuretics to rapidly lose weight before a competition. They're also sometimes used as a masking agent. So if you're doing any other of these drugs and you want to not get caught, some people use diuretics to help dilute urine and mask the presence of other banned substances. I'm not sure if it works. Then there's beta blockers. So beta blockers is an interesting one. This would probably harm most athletes because they reduce blood pressure by blocking the effects of adrenaline. So for most sports, we want some sort of adrenaline response. We want to, have an increase in heart rate, etc. Whereas a beta blocker leads to a decreased heart rate and improved sort of blood flow throughout the body, but decreased heart rate there. So it's mainly used, or people like to use it in sports where there's some sort of precision aspect or focus aspect. So a sport like archery or shooting, they've been known to use beta blockers to reduce anxiety, maintain like a steady hands, minimize tremors, and just keep a really low heart rate so they can concentrate and not let that anxiety get to them. And then the last one is stimulants. So stimulants are substances that increase the activity of the central nervous system. So increased alertness, energy, and physical performance. Examples are caffeine, amphetamines. Caffeine is an interesting one. I'm not sure exactly what the rules are, but you can definitely get high dose caffeine tablets, which I'm sure are banned in sports. But athletes might like to use stimulants to enhance endurance, reduce fatigue, and improve reaction time. But there are potential side effects to consider there as well. Things like increased heart rate, anxiety, jitteriness, insomnia, and extreme cases might cause cardiovascular complications as well. Okay, we're now going to have a look at cardiac function, so how the heart functions, heart rate and blood pressure, and what those are controlled by. We have been over some of this previously, so it'll be a little bit of revision and maybe a little bit of new content as well. So within this, we're going to look at intrinsic cardiac control. So this is mechanisms inside the heart, intrinsic inside the heart. Extrinsic cardiac control, which is outside of the heart, are the things that are controlling our heart rate, our blood pressure, that are outside the heart, and then also hormonal cardiac control as well. So firstly, let's look at intrinsic. Let's look at inside the heart, and this we have done before. So inside the heart rate is controlled by the sinoatrial node and the atrioventricular node. So the sinoatrial node is the pacemaker. It generates the impulse that initiates each heartbeat. And then the atrioventricular node is the second node, which delays the impulse so that the ventricles have time to fill with the blood before they contract. And you can see that really clearly in this video here, which I will play for you now.
This animation explains how a cardiac cycle is produced by electrical impulses in the heart. The cardiac cycle starts when an electrical impulse or action potential is generated by the sinoatrial node. The electrical impulse travels along specialized conducting fibers in the walls of the atria, stimulating the atria to contract and pump blood into the ventricles. In the normal heart, impulse travels very rapidly. As a result, all the muscle cells in the atria contract together, producing a coordinated pumping action. The impulse also travels across the right atrium to the atrioventricular node, where it is delayed slightly to allow the ventricles to relax and fill with blood before they contract. The impulse travels along the bundle of His, where the conducting pathways divide in two, forming the left and right bundle branches, which lie in the interventricular septum. From the bundle branches, the impulse spreads into the inner walls of the ventricles via specialized conducting fibers, called Purkinje fibers. Finally, the impulse travels up the outer walls of the ventricles towards the atria. The rapid and controlled spread of the electrical impulse through the ventricles stimulates the muscle cells in the ventricles to contract together and pump blood efficiently to the lungs and body.
Okay, so that is the intrinsic control of the heart. It's the sinoatrial node and the atrioventricular node. Now, there are things outside the heart which control the heart rate, the force of the contraction of the heart, and the blood pressure. Those being the sympathetic nervous system, which we know now is our flight or fight. It increases the heart rate, it increases the force of contraction of the heart, which enhances the stroke volume, which is the amount of blood we pump out in one beat, and the cardiac output, which is the amount of blood we pump out within 1 minute during exercise. The parasympathetic nervous system also helps to decrease heart rate and the force of contraction during recovery. And then finally, we also have the baroreceptors, and these are the receptors in our blood vessels that monitor blood pressure and signal for the nervous system to adjust if there's any deviations. So here we can see a bit of an outline of what our parasympathetic versus sympathetic nervous systems control. You can have a closer look at this in your own time. But also, in terms of the baroreceptors, something to consider in terms of the way that they function is, have you ever stood up and you all of a sudden feel really dizzy if you stand up really fast and you get almost lightheaded? It's because with gravity, when we stand up quickly like that, it causes the blood to pool in the lower body, so our blood sort of sinks within our lower body, which leads to a temporary decrease in blood pressure, and that's why we get that lightheadedness. Now, of course, the baroreceptors are going to pick up on that drop in blood pressure, and they then stimulate the sympathetic nervous system to increase heart rate, increase the contractility, so the forcefulness of the heart beating, and to vasoconstrict, to narrow the blood vessels to increase the blood pressure. And all of this increases the blood pressure. So when we have that sudden drop in blood pressure that happens when we stand up quickly, the baroreceptors identify that, they stimulate the sympathetic nervous system to increase heart rate, contractility, and vasoconstriction, all to stabilize the blood pressure and achieve homeostasis. Okay, in terms of hormonal cardiac control, it's adrenaline and noradrenaline. These are the two key cardiac hormones. Released from the adrenal glands, they increase the heart rate and force of contraction, so very similar to the sympathetic nervous system. They also promote the breakdown of glycogen in the liver and muscles to provide energy for quick exercise. So in terms of hormonal control of the heart, we're thinking adrenaline and noradrenaline. Okay, we're on to looking at thermoregulation. This term means temperature. So temperature regulation. How do we control our body temperature? And how does the skin play a role in that as well? So you guys do need to know some of the different features of the skin. It's quite basic. The two layers, the first one is the epidermis. This is the outermost layer of skin. And then we also have the dermis, which is located underneath the epidermis. It's a thick layer made of, connective tissue that provides some strength and elasticity and support to the skin. In terms of components, we have glands. So we've got a few different types of glands. You can see I've used 2 arrows there, but there's many other glands in that picture. The main ones that we need to know about are, of course, our sweat glands, which are all over the body and help with temperature regulation. We also have sebaceous glands, which produce oil to lubricate the skin and the hair. We have hair follicles that you can see there, and we also have the layer of fat at the bottom. This is our subcutaneous fat. Remember, I taught you about under the skin fat is called subcutaneous fat at the bottom. Okay, in terms of functions of the skin plays a really critical role in the regulation of body temperature. It helps to maintain a stable internal temperature, and it does that through sweating and vasodilation or vasoconstriction, depending on if we're hot or cold. The skin also acts as a barrier and protects our body from, external threats. So we have the epidermis, which helps protect us from physical injuries. Imagine you didn't have skin, I'm sure you'd get injured a lot more than what you do now. And there's also some immune function of the skin as well. We've got some special immune systems in our skin. Sensation is also another important function of the skin. It can pick up touch, temperature, pain, etc. It also helps in the excretion of certain substances like sweat and the absorption of vitamin D, which is really important for our bone health. Okay, so we've spoken about body temperature before. We looked at this negative feedback loop of how our body actually maintains a stable body temperature. We're going to look at that a little bit more in depth now. So the first thing we need to understand is cellular metabolism and heat production. So when in the simple form, when our cells make energy, we are also making heat at the same time. It's at about a 40 to 60% ratio. So let's say we're using glucose to create energy. About from that one glucose, about 40% of it is becoming ATP and 60% of it is being released as heat. So we're generating quite a bit of heat. Now, there's a few different mechanisms and ways that our body actually does thermoregulation and does maintain a stable body temperature. The principles that we need to know are conduction. So conduction is direct heat transfer through contact. For example, lying in a bunch of snow will lower your body temperature, especially if you don't have clothes on. So conduction is like sitting on a cold bench. That is going to lower your body temperature. It's through direct transfer. Convection is heat loss through air. So let's say wind can increase the rate of heat loss from the body. And then evaporation is the process of sweating. It's where heat is lost as sweat evaporates from the skin. So conduction is direct transfer, convection is through air, and evaporation is sweat evaporating on the skin. Now, importantly, there's two things to look at as well. Firstly, humidity. So the more humid the temperature is, the lower the rate of evaporation, making it harder for the body to cool down. Because if there's a lot of water in the air and the air is very humid, the water on your skin won't want to evaporate. Wind as well is an important one. So wind chill can increase the rate of heat loss through convection. So this is the air one. So through convection, say if it's a temperature of 5 degrees Celsius, but there's a wind of 20 kilometers an hour, that can feel like 1 degree Celsius. So that can really accelerate the rate of heat loss. Now, we've already spoken a bit about exercise in the heat, but we're going to revisit it again just quickly. So in terms of the physiological response, what actually happens to our body when we're exercising in the heat, the first thing is vasodilation. So there'll be enhanced blood flow to the skin to cool down through this convection process. So that's why you get your red face, because you're getting more blood coming to the skin to cool down from the air. Number 2 is sweating. So sweat will be produced in response to an elevated body temperature for cooling through the evaporation process. And then the third one is energy metabolism. So when we exercise in the heat, we have a lower blood volume going to the exercising muscles. And we've gone through this before, how vasodilation and how sweating lead to a lower blood volume going to the exercising muscles. If there's lower blood volume going to the exercising muscles, it means that these muscles can't get as much oxygen as what they would like to, which means that the lactate production will increase, and that lactate production is what makes your muscles feel sore and tired and leads to a decrease in performance or leads to fatigue. In terms of risks of exercising in the heat, the first one, of course, is dehydration. So you have a loss of fluids that results in thirst, dry mouth, fatigue, and decreased performance. You can also get heat cramps, so painful muscle contractions due to electrolyte imbalances. Normally, cramps are very much related to hydration status. So exercising in the heat reduces our hydration, can potentially lead to cramping. And then also on the more serious side, we have heat exhaustion, which is where we have an excessive loss of water and electrolytes that may result in weakness, dizziness, headaches, and nausea. And this can lead to heat stroke, and heat stroke is very serious. It's a life-threatening condition, and you need to call an ambulance if someone is having heat stroke where they become confused, dizzy, or unconscious. In terms of strategies for exercising in the heat, how can we reduce this decline in performance in the heat? First thing is heat acclimatization. So to acclimatize to the heat, athletes should gradually increase their training intensity in a similar environmental condition. Normally 5 to 10 days to help the body adapt is sufficient, and that process will enhance the physiological adaptations like improved sweat response and plasma volume. And I'll talk about those adaptations in a second a little bit deeper. So national sports teams, for example, soccer teams who are based in England, who have a match or a really important match in Qatar. Sometimes they go over to the host country for a few days or weeks to acclimatize to that environment. Hydration is also important, so pre-exercise and during exercise. Clothing, so we want to make sure that the clothing is moisture wicking so we can get that sweat to evaporate. And light colors also are good because they reflect the sunlight. And taking rest breaks in shaded or cooler areas to allow the body to recover and cool down. Now, in terms of adaptations to exercise in the heat, so people who live in really hot areas of the world, they have a few physiological adaptations to help them cope with that increased temperature and maintain homeostasis. So some of the key adaptations are an increase in blood volume or an increase in plasma volume. So when we adapt to the heat, this often involves an increase in our plasma volume, our blood volume, which helps to maintain our blood pressure and improves our cardiovascular efficiency during exercise, especially because when we lose fluids through sweating, some of that comes from that plasma. So you want to be able to have more plasma there to maintain a more normal blood volume. People who live in the heat normally also have enhanced sweating. So the body can actually increase the number of sweat glands and allow for more efficient cooling through sweat evaporation, so they're able to sweat more. And they also tend to have a lower sweat threshold, so people living in a really hot climate often begin to sweat at lower temperatures, which improves their ability to cool down quickly. Okay, we're going to talk about exercise in the cold now. So first thing to cover is the physiological response. What happens when we exercise in the cold? Firstly, we have vasoconstriction. So the blood vessels will constrict and become more narrow to reduce the heat lost from extremities. We will have shivering. Now, shivering is an involuntary muscle contraction that generates heat. And we will have an increased metabolism. So the body's metabolic processes will increase to generate more heat without having to move our muscles. So they'll normally burn more calories in a cold environment just because of that heat production. In terms of the risks, we have hypothermia. So this is a dangerous drop in core body temperature that can impair our bodily functions. And you can see the different stages of hypothermia here. So cold stressed to mild hypothermia, moderate hypothermia, which is where there's no more shivering and no more alertness. And then severe hypothermia under 28 degrees Celsius is a loss of consciousness. And we also have frostbite. So this is tissue damage that's caused by freezing, particularly happens in the hands, feet, and nose. In terms of strategies for exercising in the cold, you want to think about clothing. Now, in terms of clothing, we want a moisture wicking base layer so that sweat doesn't accumulate and sweat doesn't make us more cold. So we want to get rid of that sweat. If we have that accumulation of sweat, that can lead to hypothermia. So we want something that's going to get rid of the moisture from sweating. We want an insulated mid layer, and insulation is normally measured in Clo units. I've put that in there because it's in your syllabus. So Clo units is referring to insulation, and then a waterproof outer layer to keep dry. In terms of adaptations, so people who live in the cold, they have a few interesting adaptations. Firstly, they have an increased metabolic rate. They burn more energy. So this is to counteract the effects of the cold and to generate some heat through this metabolic processes. They also have increased fat stores, so people who live in cold environments may develop more subcutaneous fat, which helps to provide some insulation and conserve body heat. Okay, we'll look at altitude and performance now. So this is very relevant for you guys. Firstly, important to know the different categories of altitude. So if we are near sea level, that's 0 to 500 meters. Low altitude is 500 to 2,000. Moderate is 2 to 3,000. That's supposed to only say 3,000 there. High altitude is 3 to 5,500, and then extreme altitude is anything above 5,500. So let's look at some examples in the surrounding area. So Val d'Isere is 1,900 or hereabout meters. This is considered low altitude. Obviously, it's still quite high, but in our rankings, it's a low altitude. This is just in the town, not in the ski resort, just in town. In town, there is 21% less oxygen in the air compared to sea level. If we look at Mont Blanc, which is 4,800 meters high, this is high altitude. There's around 50% less oxygen than at sea level. And at Mount Everest, 8.8 thousand meters high is extreme altitude with 67% less oxygen than at sea level. Now, what happens when we don't have enough oxygen for our cells? This is called hypoxia. So when there's not enough oxygen to supply our cells, we often have shortness of breath, which is difficulty in breathing or feeling like we're not getting enough air, a rapid heart rate, as the body tries to compensate for low oxygen levels. Same thing for an increased breathing rate as we're trying to take in more oxygen. Headaches, so with the reduced oxygen supply to the brain, we can get a headache. We can feel confused, dizzy, or lightheaded. We can get cyanosis. So cyanosis is when we have a bluish tint to the skin, lips, or fingernails, and it indicates low oxygen levels in the blood. And if this is super severe, that can lead to a loss of consciousness. So fainting or loss of consciousness can occur in a very, very severe case. So some of these are quite normal. Some of these maybe happened to you or some family or friends who came to visit you in teen, but then some are more serious. So maybe headaches and a higher resting heart rate are quite common, just even being at the altitude that we're at now. Whereas loss of consciousness and cyanosis wouldn't really happen until you're quite a bit higher up. Now, altitude training is what we're going to focus on next. So, altitude training is athletes who train at altitude for several weeks or months. It's normally endurance athletes who like altitude training. The benefits are mainly for endurance athletes, and it's usually done just before competition because the effects of altitude training don't last very long. We saw that when we looked at EPO. So let's have a look at the benefits of altitude training now. So we get an increased red blood cell production. So when there's not enough oxygen in the body, the kidneys are going to produce erythropoietin, EPO, which is going to tell my body to produce more red blood cells. If I have more red blood cells, I can carry more oxygen. I'm also going to get an increased mitochondrial density. So to counteract this lack of oxygen, the body's actually going to build more mitochondria. I'm going to get more mitochondria. So you can see in the first picture, I've only got 3. In the second picture, I've got 6 or 7. So with more mitochondria, I'm able to produce more energy and thereby improve performance. I'm also going to get enhanced capillary density. So the number of capillaries running through my muscle is going to actually increase. And this enhances the muscle's ability to utilize oxygen efficiently. So if I've got more blood running through, that means that there's more oxygen for me to be able to pick up within those muscle cells. It just increases the availability of blood and therefore oxygen. So it can improve our endurance performance as well. Now, there's a few different strategies that are used by athletes to enhance their performance and acclimatize their body to lower oxygen level. Each strategy has got its benefits and disadvantages, and their effectiveness is very much based on the individual athlete, what their sport is, what their needs are, what their goals are. But the three main strategies are live high, train high. So that would be you guys right now. You're living at altitude and you're training at altitude. The next one is live high, train low. So this is living at altitude, but then going down to do your training. And the last one is live low, train high. So living at sea level, but then coming up the mountain and doing your training. Without knowing anymore, I want you to try and pick one and decide which would be the best, which one would offer you the best benefits, whatever your sport is. Let's have a look at live high, train high now. So like I said, that's you guys. You live high and you train high. So the benefits are complete acclimatization. You're training and you're living at high altitude, and that leads to the maximal physiological adaptations like increased red blood cell production and enhanced aerobic capacity. You're going to increase your endurance capacity. So you've got sustained exposure to low oxygen, which is going to improve your endurance performance. So it's super beneficial for long distance athletes. However, there are some disadvantages. Firstly, is you're not going to be able to train at the same intensity. Your intensity is going to be lower. Because there's lower oxygen level, that can lead to decreased training intensity and volume, which may affect your performance gains. There's also fatigue and slow recovery. So training at high altitudes can result in big fatigue and prolonged recovery times because of the body's increased energy demands. So you need to be sure you're making your recovery, you're taking your recovery seriously. The next one is live high, train low. So advantages of this is you get the adaptations from training at a high intensity. So if I live up in the mountains and I go down to Annecy to do my training, I'm able to train with the same intensity I would as if I was at sea level, because I've now got the oxygen availability. I'm not going to be dying training. I'm going to be able to complete the correct amount of work at the correct intensity. I'm not going to be struggling because there's no air to breathe. I'm going to have enhanced recovery and less fatigue, because training at a lower altitude can promote better recovery because we have improved oxygen supply to the muscles, which leads to less fatigue. However, the disadvantages are I'm not getting the complete acclimatization. So I've still got acclimatization adaptations because I'm living high, which still stimulates the kidneys to produce EPO to increase my red blood cells, but maybe it's not at the same level as if I was training high as well. The other disadvantage is logistics. It's very hard to find somewhere where you can live in the mountain and train back at sea level. It's logistically challenging. An old colleague of mine went to Qatar with a soccer team once, and they implemented this brand new training facility. I found a picture online. I'm not sure if this is the exact same picture, but basically it was a soccer team, and they made their bedrooms low oxygen environments. So even though they were living at sea level and training at sea level, they made the rooms so that there wasn't much oxygen in there, so that they could get some sort of adaptations of acclimatization to this low oxygen environment whilst they were sleeping and getting ready in the morning, and then they'd go out of their rooms and do their training at the same intensity. And so this is normally the best recommendation. This one, live high, train low, is said to have the greatest benefits because we're able to maintain training intensity and get the benefits of acclimatization. The last one is live low, train high. So the benefits of this is, firstly, it can actually be accessible. So there's lots of low oxygen training facilities now. So you can see in the picture that there is things like this. Even at regular gyms now, some of them have these hypoxic rooms where it's just a room where they reduce the oxygen in that room. So it seems like you're training at a high intensity. You can also have enhanced recovery and less fatigue with this method, because as soon as you leave the room, you're getting all that oxygen back, and that's promoting recovery. However, this is my least favorite style because you're not getting any of that acclimatization effect. Very limited acclimatization. It's like an hour a day or whatever it is that you're training in there. So it's not going to stimulate your kidneys to produce an amount of EPO that's going to make a difference to the amount of red blood cells you have. And the other disadvantage is that you're just lowering your training intensity. You're just making your training harder. So you're not doing as much work, as much intensity, because there's less oxygen available for you. So for me, this one really doesn't make sense. I think these hypoxic rooms are quite useless. I mean, I'm sure they have their benefits for maybe someone who's training to go climb a mountain and doesn't have access to be in a high altitude. It can be useful there, but for a performance effect, if we're talking about sport and performance effect, I don't believe that these hypoxic rooms are going to be very beneficial. So a little summary of the different strategies. Live high, train high is the best for acclimatization, but it hinders our training intensity because there's not enough oxygen to maintain the intensity that we would if we were at sea level. Live high, train low has significant benefits for endurance and recovery and allows for high intensity training. So this is considered the best. And live low, train high, we don't have acclimatization advantages and we are reducing our training intensity. So it's almost a double negative for that one. The risks of altitude training now, this is when we get quite high up in the mountains. But firstly, in terms of risks, we have altitude sickness, which is also called acute mountain sickness, which is dizziness, headache, nausea, vomiting, shortness of breath, and elevated heart rate. When we get quite high up, we can be at risk of high altitude pulmonary edema. This is when fluid accumulates in the lungs and we have a shortness of breath, an elevated heart rate, coughing, wheezing, and cyanosis. You can see in the picture we have clear normal lungs and then we have pulmonary edema where there's a fluid buildup in the lungs, and this can be very dangerous. But the most dangerous of all is high altitude cerebral edema. This is when fluid accumulates in the brain and can lead to confusion, fever, severe headaches, and loss of consciousness, and this happens at very high altitude. So you can see here in the green, roughly at about 3,300 meters, we can get symptoms of acute mountain sickness. Around 3,500 to 4,000 meters, that increases the probability of high altitude pulmonary edema. And then above 4,000 meters, we have this chance of cerebral edema as well. In terms of strategies to avoid those, really important is hydration and electrolytes. At high altitudes, dehydration occurs rapidly, so we need to make sure that we're increasing our fluid intake during exposure to high altitude. In addition to water, we also want to make sure we're maintaining electrolyte balance. We want to ascend gradually, so athletes should ascend to higher altitudes slowly and allow their bodies time to acclimatize to the lower oxygen levels. There's a recommendation of about 300 to 500 meters per day when we get above 2,500 meters. So for us, that's not really an issue. We should increase exercise intensity gradually, so ease into the training routine, begin with lower intensity workouts and gradually increase as the body adjusts. And then there's also medication that we can take as a preventative measure against acute mountain sickness or altitude sickness. Okay, and we're at our final part of this unit. This is going to be very quick. I just want to talk to you about the two systems and their response to exercise. This is a very brief recap of the things that I really want you to remember from this unit. So firstly, the nervous system. Remember that the sympathetic nervous system increases heart rate, blood pressure, and respiration to ensure oxygen supply to muscles, flight or fight. After exercise, the parasympathetic system promotes recovery by lowering heart rate, promoting digestion and tissue repair. This is our rest and digest system. In terms of the endocrine system, you need to know that short term, we have the secretion of adrenaline, noradrenaline, and cortisol during exercise to boost our heart rate, to release our glycogen stores, our energy stores, and to increase alertness. And long-term exercise will enhance our insulin sensitivity, so the way our body will respond to insulin very well with long-term exercise. For the endocrine system as well, I want you to know between strength training and endurance training, there's a few differences. So with strength training, testosterone, growth hormone, and cortisol levels will rise to promote muscle repair and growth. With endurance training, it's a little bit different. It's cortisol and adrenaline increase to release energy, and that's where the insulin sensitivity improves over time and we have better blood glucose regulation. Okay, that is all for the end of exercise physiology.